Hi, my name is Paul Young, and I am going to tell you today about the BSc in Biomedical Science. This course has a CAO code of CR320, and it's a joint course between UCC and MTU, and the code is an MTU code, if you like, rather than a UCC code, but it's a joint course. So I'm a lecturer in the School of Biochemistry and Cell Biology, and this is one of the schools in UCC that's involved in the course, and I'm Program Deputy Director. So first off, what is biomedical science? Biomedical science is a profession, a dynamic profession, and it involves the study of diverse subject areas that are shown here. So biochemistry, microbiology, cellular pathology, hematology, and transfusion science. So these would be the main areas within biomedical science that you would study during the course. Biomedical scientists they're also called medical scientists. What is a biomedical scientist? So they are healthcare professionals. So just like doctors, nurses, etc., they're healthcare professionals, but their expertise is in laboratory medicine. So what they do is they're involved in testing of tissue or body fluid samples that might be taken by a doctor or nurse, and then they run tests in the lab to diagnose disease and evaluate maybe the effectiveness of a treatment, whether treatment's working or not. As a patient, you'll see the doctor or the nurse. You'll rarely, if ever, see the biomedical scientist, but interaction between doctors and nurses and biomedical scientists is critical so that they can, get tests done, get results back, and then make clinical decisions based on those results. So the biomedical scientist is a really important player in the healthcare system. So they are responsible for accurate, reliable laboratory tests, and doctors then treat their patients based on those results. That can involve diagnosis and deciding on treatment for really serious, life-threatening conditions, things like cancer, diabetes, AIDS, COVID-19. So those tests have to be done in a timely, accurate, reliable fashion to really high standards. Hospitals will have a medical scientist on call more 24 hours a day in most hospitals. So biomedical scientists will work in shifts and on-call rosters so that there's always cover, so that in a hospital you can get tests done quickly in a timely manner for a patient who's in ICU, for example. Okay, so the BSc in Biomedical Science, the program structure is divided between UCC and MTU. You'll spend, as a student, about half your time in MTU, half your time in UCC. As I mentioned, this is the CAO code. There's up to 40 places on the course. It's a 4-year course, and your qualification at the end of the course is a level 8 qualification, a BSc Honours in Biomedical Science. The course is run by a management team that consists of staff from MTU and UCC. There's a director who at the moment is Dr. Leslie Cotter from MTU, and I'm the deputy director. And then you have staff from both institutes who are on this board of studies, which essentially is responsible for running the course. And these are some of the same people who will lecture you during the course in different subjects. It is a joint program, that makes it maybe slightly more complicated, but on balance, I think having the joint program is hugely beneficial, and you get the best of both worlds. So, you've got a student card from UCC as well as MTU. You've got access to both campuses, both facilities, the facilities of both campuses, just speaking for UCC. UCC is one of the top ranked universities in Ireland and highly ranked worldwide. We have excellent stats on employability for our graduates, and we're highly ranked in areas of student experience, sustainability, gender equality, and so on. So UCC is a great place to come and study. Great student experience and great academic experience as well. And similarly for MTU, it's a fantastic institute. It's got a very strong tradition in hands-on kind of practical training, which is essential for the biomedical science course. So you get the benefit of both institutes. Apart from the academic side, you've got clubs and societies from both institutes, and you as students you'd be we'd really encourage you to get involved in lots of extracurricular activity, meet students outside your class, and pursue your different interests. And there's such a diversity of clubs and societies that there's something there for everyone. Again, you have a choice between societies and clubs from UCC or MTU, and I suppose one society that is particularly relevant is the Biomedical Science Society, which is really active, organises different seminars, events, conferences. Best thing to do if you're interested in societies, just look up their Facebook page. They actually have lots of information there about biomedical science as a career and what it's like to work as a biomedical scientist. So that's worth checking out. So coming back to the academic side, if you're looking for more information in detail about what's in the biomedical science course, then you can go to this web page here. And then you can click on each year and find out what you'll be doing in each year of the course. We'll just take a quick look at first year. In first year you would do physics, maths, chemistry, about 10 credits worth of each subject there. You'll do some kind of introductory biology, and then you'll do some introductory biomedical science, which kind of is more specific to the biomedical science degree, and talking about the different aspects of being a biomedical scientist and the kinds of knowledge you need in those areas. So overall you do 60 credits. So in universities, I suppose each module, as they're called, is usually broken into either 5 or 10 credit chunks, and you get a total of 60 credits that you take in each year. Each module has a code. In fact, has 2 codes, a UCC and an MTU code. And as you see here, some of these are delivered by MTU and some by UCC, and that balance varies from year to year. Overall, it's about 50-50 across the whole course. So as you go through the years, then you specialize more in those areas that I mentioned already, things like microbiology or biochemistry or hematology. And in the final year, you do a research project, which is a big part of the course and a big part of the final year, and one of the experiences that the students really speak highly of after they graduate. That's the BSc in Biomedical Science. That's a 4-year course. 8 on its own is not enough to allow you to practice as a biomedical scientist in Ireland. You must also complete what people usually refer to as the clinical placement. But the qualification you get for this clinical placement is a postgraduate diploma in clinical laboratory practice. So you can only do this postgraduate diploma and do the clinical placement if you have finished and graduated from the BSc degree in biomedical science. And usually this clinical placement runs immediately after you graduate with the BSc, so from September to May the following year, about 9 months in a hospital lab, where you rotate through, I suppose, the different disciplines of biomedical science. So transfusion science, hematology, medical microbiology, clinical biochemistry, histopathology. So you'll spend a couple of months, I guess, in each of those areas, getting learning about those areas, and maybe getting a taste for what you'd like to specialize in, when you go on into employment in a clinical lab. So that's the clinical placement. The course then, both the BSc undergraduate degree and the postgraduate diploma in clinical laboratory practice are accredited by the Irish Academy of Clinical Science and Laboratory Medicine, and the British Institute of Biomedical Science. And this accreditation, dual accreditation, means that graduates with the of this joint program are eligible to work in clinical labs in Ireland, but also in places like the UK and Canada, New Zealand, Australia. And on top of that, there is regulation of biomedical scientists by CORU, which is the state regulator for healthcare and social care professions in Ireland. graduates who complete both of these undergraduate and postgraduate diplomas can register as biomedical scientists with CURU, and you have to be registered as a biomedical scientist with CURU in order to work in a hospital lab in Ireland. It's a professional course that is accredited and recognised by the regulatory authorities to allow you to work as a medical scientist. Entry requirements then for the course, highlighted here. You need a minimum H4 in a lab science subject. You need 1 H5 and 4 O6s or H7s from subjects which must include then maths, English and Irish. It's a popular course. The entry points, CAO entry points are listed here for going back 10 years or so. So the points in the last few years have been well above 500. Last year in 2020 was 565, which is maybe a little bit of a blip because of estimated grades being used for the leaving certificate, but the points are relatively high for the course because it's a popular course. Wanted to look next at career opportunities in biomedical science. Where are you going to go with your degree in biomedical science? So, having completed your BSc in biomedical science, the majority of students, probably more than 90%, will continue and do the postgraduate diploma in clinical lab practice, the clinical placement that I mentioned, and most of those will then go on to work in hospital labs. So that's really what the course is designed for, and that's the route that most people take. But this course is not forcing you down that route. It's a really good BSc degree, science degree, and you can do, at the end of it, you can do anything you could do with any other science degree. You can go into research, you can get jobs in industry, and some graduates do that. And so a number of students will go into research, do master's degrees, PhDs, maybe others will get jobs in industry, and some will go on to other kind of graduate degrees, professional degrees like graduate entry, medicine, dentistry, pharmacy, etc. So you can do all those things with your BSc in biomedical science. So just looking, I suppose, at what the majority of students will do, which is to do the diploma and then work in a hospital lab, what's involved there. So mentioned already, the main disciplines in biomedical science are transfusion science, hematology, sometimes they're put together. They both kind of deal with blood, and medical microbiology, clinical biochemistry, histology and histopathology. So those are the disciplines. So transfusion science, then what is that? So it's really the practice of cross-matching blood components for healthy transfusions. So you probably have heard of blood types A, B, and AB and O. You may know your own blood type. Biomedical scientists are responsible for kind of handling blood that's donated, checking its blood type, also doing other checks like testing for viruses, etc., or preparing different components from the blood, like platelets, for example, for transfusion. So they have to ensure, and it's critical that blood transfusions are done in a safe manner, and that only compatible blood is given to a patient. So they will do tests to check for compatibility or non-compatibility of the blood. That's transfusion science. So the blood banks, which you'll have in some of the bigger cities in the country, you'll have biomedical scientists working there, handling and processing and testing the blood. Medical microbiology, then, as you might imagine, is a study of microorganisms, and biomedical scientists work in medical microbiology to isolate and identify disease-causing microorganisms. It could be bacteria, it could be viruses, so it could be salmonella, it could be hepatitis or COVID-19 even. And then they will do tests on those to identify the presence of those pathogens, also to test maybe their susceptibility to treatment with antibiotics or other antivirals or other kinds of therapies. So that's medical microbiology. Clinical biochemistry then involves running tests to look for things like hormones, enzymes, lipids, blood, sugar levels, vitamins, maybe drugs, etc. in blood or urine usually. So again, samples taken by a doctor or nurse are sent to the biochemistry lab to be analysed, and then the report goes back to the doctor with an indication of whether the presence or levels of these components are normal or abnormal, and then the clinician can make a decision based on that. And sometimes even the medical scientists are involved in some of those clinical decisions. Often, biochemistry labs will be looking at response to treatment. So once treatment has been initiated, then are these parameters improving? Is the treatment working? So histology and histopathology then is the last discipline we're going to mention, and this is the microscopic study of biological cells and tissues in normal and diseased samples, and not entirely, but a lot of this work is to do with diagnosis of cancer. So taking somebody who's maybe suspected of having cancer may have a biopsy taken, and then a biomedical scientist working in a histopathology lab will maybe take sections from those tissue samples, stain them, and determine whether the tissue looks normal or whether it's tumorous. And then, if it looks tumorous, is it malignant or is it benign? And that determines then whether the patient needs treatment or surgery, chemotherapy, etc., or maybe they don't, or to decide what level of treatment is appropriate. So those are the kinds of things that biomedical scientists who go on to work in a clinical lab will be doing. But as I mentioned, you can go down other routes. There are lots of opportunities for biomedical scientists to work in industry, so either without doing a clinical placement year or maybe after doing a clinical placement year. And in Ireland we are lucky to have many of the top pharmaceutical and biotech companies having facilities here. So companies like Eli Lilly or Novartis, Pfizer, Regeneron, etc. And then other careers outside of clinical labs would be going down the research route, which might be to pursue a master's degree or a PhD, to do maybe 1 year or 3 or 4 years of research in case of a PhD, and then maybe continue a career in research. And then other graduates, again, could be either with or without doing the clinical placement, might go into graduate entry professional degrees like medicine, pharmacy, dentistry. So with your BSc in Biomedical Science, the world is your oyster, and you can go into clinical labs, but you can do lots and lots of other things as well.